We're going to be talking about upper eyelid blepharoplasty surgery. We often get patients referred to the clinic with what we call droopy eyelid, don't we?
Yeah, well that's quite a broad term, isn't it? So what does that really mean?
So it is quite a broad term, and the difficulty is that often patients come in thinking that the eyelid itself is droopy, but you have to see whether it's the actual eyelid position that's low, whether the excess skin on the top of your eyelids here, whether that's putting pressure on the eyelids and making them look droopy, whether they've got asymmetrical eyebrows, or whether it's a combination of all those things. So it's really important when you see a patient that you ask them to show you what they are unhappy with and what they'd like us to help them with.
Yeah, so what will they be expecting? They come in for a consultation, what should they expect?
So we always do a full facial consultation and examination, but it's really important to also do a thorough eye examination because issues with the eyes can affect your eyelid position and vice versa. And it's really important if you've got issues in your eye that they're treated, and we can warn them if they're at a high risk of complications or risks. And we can mitigate those risks if we know of them in advance when we're doing the surgery.
So if the main issue is their skin, what does that intake?
So if they just have the excess skin, that's a condition called dermatochalasis. And it's very common as we age, as the skin around the eyelid becomes more lax and our tendons and ligaments all become more lax with age, and we're always fighting.
Really? You're telling me?
Yeah, we're always fighting gravity. So essentially your whole face tends to sag downwards, and that excess skin on the eyelids is actually quite a common feature that we see in patients. Some patients are more prone to it, so it can run in families. So often patients will say, "Oh, my mum and dad had very similar eyelids."
It's really say that.
Yeah. Or some patients who have got very fair skin, if they've had quite dramatic weight loss, and it's a lot more common in patients who've got a history of smoking.
So as well as the cosmetic changes, can it cause any other problems?
It definitely can. So in the majority of patients, they're unhappy with the sort of tired feeling that they feel with that excess skin and looking tired. Some patients feel frustrated that they can't wear eyeshadow, makeup like they used to because they don't see this normal skin crease, and they feel that means that their eyeshadow and makeup goes all over the place. Some patients complain of their eyes feeling quite irritable because the weight of the skin can sit on your eyelashes and it can actually affect your tear film. In more extreme cases, particularly in older patients, when they actually get hooding of their eyelids, it can restrict their peripheral vision. So often it's more of a functional problem for them.
Yeah, so it will be. And how do you treat it? Because you hear a lot in the news, non-surgical, solutions or treatments. How do you treat it?
So there are non-surgical options, and it's quite confusing for patients because there seem to be so many options. And you hear about things like dermal fillers, PRP injections, microneedling, laser resurfacing. And for mild excess skin, you can sometimes get some benefit with those options. The difficulty is if those the results are often limited and they're short term. So the optimum treatment really would be to do surgery to remove that excess skin.
Okay, so the surgical option really, isn't it?
Yes.
So what is that about?
So the operation is called an upper eyelid blepharoplasty, and what we do is we utilise your natural skin crease in your eyelid, and we remove the excess skin, and then we stitch the free ends together. Now, the most important part of that is usually the marking and the measuring of the eyelids prior to the surgery. The really important part is that we remove enough skin so that the patients notice the benefit and they get the desired outcome, but you don't remove too much skin, because the most important thing with regards to the eyelids is that you can still blink normally and close your eyes normally. And as well as causing a not so great cosmetic result if you take too much skin, the worry is that it will pull down your eyebrow and it will cause a problem with you being able to close your eyes. So the eyes can get really quite sore, dry, and it can lead to long-term damage.
You switch a problem for another, don't you?
Yes.
Yeah.